Hello everyone. Today the topic that we'll be talking about is cellulitis. Cellulitis is an acute and edematous spread of an acute inflammatory process. It usually occurs due to a dental infection and it may lead to a more serious complication. The two types of cellulitis are the Cavernous Sinus Thrombosis and the Ludwig's angina. Today in this video we will be specifically talking about Cavernous Sinus Thrombosis. So, as the name tells us, Cavernous Sinus Thrombosis is a formation of a thrombus or a clot within the cavernous sinus. So, in order to understand this better, let's go through the anatomy of the cavernous sinus and some of the structures that surround it. So, the cavernous sinus is a group of thin-walled veins that are located lateral to the wall of the sella turcica and medial to the temporal bone. Superior to it is the optic chiasm. The trochlear nerve, the oculomotor nerve, maxillary and the ophthalmic branch of the trigeminal nerve runs through the area. In addition to this, the internal carotid artery and the abducens nerve travels within the sinus. The sphenoid bone is located inferior to the cavernous sinus. Just above the sphenoid bone is the sphenoid sinus, whereas the nasopharynx is located just below it. Above the sella turcica is the pituitary gland. Now, the cavernous sinus can be classified into two types. There is the septic cavernous sinus thrombosis. This is a thrombopholebitic process with an infectious origin. It may originate in the middle third of the face, sinus, ears, teeth, or the mouth. In this, inflammation of the arteries occurs. The danger triangle of the face originates from the corners of the mouth and extends to the bridge of the nose. So, in septic cavernous sinus thrombosis, this danger triangle is involved. There is embolization of the infectious organism, which causes the formation of a thrombus, which is then trapped within the cavernous sinus, and within the cavernous sinus, the infection is trapped. Now, the aseptic cavernous sinus thrombosis, as the name tells us, is not due to the bacterial infection. It could be due to trauma, iatrogenic injuries, or prothrombotic conditions. The cavernous sinus thrombosis may occur through two pathways, the anterior and the posterior. So, the anterior pathway, in this, the infection travels from the maxillary anterior tooth and spreads to the facial maxillary bone. This spreads to the canine space. The septic thrombus occurs in the valveless facial veins. This means that there are no valves in the veins, so the thrombus can move either in the forward direction or the backward direction. Now, when this occurs, there is a retrograde propagation from the angular vein to the inferior ophthalmic vein. We can see these veins in the picture below. Right here is the angular vein, and extending from this angular vein, going under the eyeball is the inferior ophthalmic vein. When this happens, the inferior ophthalmic vein travels to the inferior orbital fissure and enters the cavernous sinus. Over here in this picture, we can see the inferior orbital fissure through which the ophthalmic vein travels and joins to form the cavernous sinus. The next pathway is the posterior pathway. In this, the infection is originating from the maxillary, premolar, or molar teeth. So, the posterior maxillary teeth. Now, the buccal and the infratemporal space is involved. Here's a picture which allows us to appreciate the buccal and the infratemporal space. Now, this thrombus moves through the pterygoid venous plexus and enters the inferior petrosal sinus. This occurs through a small connection known as the emissary vein. Now, this infection is carried to the cavernous sinus. As we all know that the cavernous sinus is also on the left and the right side, so there is a communication between it. If the spread of the thrombus occurs to the other side, then the cavernous sinus is said to be bilaterally involved. Now, let's look at some of the clinical features that cavernous sinus thrombosis presents with. There is an edematous periorbital enlargement which involves the eyelid and the conjunctiva. The patient usually complains of a headache. But if the canine space is involved, the swelling is present along the lateral border of the nose, and it may extend to the medial aspect of the eye and the area around the orbit. Usually there is pain over the eye, and there may be a loss of the blink reflex. Now, as we all know that the cavernous sinus thrombosis leads to a decrease in the drainage system. So there are some symptoms related to the eye. First of all, there may be pupil dilation. There also may be lacrimation, photophobia, meaning an increased sensitivity to light. Also, there may be loss of vision. Now, the loss of vision may be unilateral at first, but if the thrombus spreads to the other side of the cavernous sinus, there may be complete visual failure. Ophthalmoplegia. Ophthalmoplegia is basically the paralysis of the ocular movements, and the most common paralysis is seen on the lateral movement of the eye. This occurs because there is an increased pressure on the sixth cranial nerve. We may also see proptosis, anterior bulging of the eye. This is due to an increased intraocular pressure. Some patients may also go through ptosis. This is the drooping of the eyelid, and this occurs due to an increased pressure on the oculomotor nerve. There also may be chemosis. This is an irritation of the eye, and sometimes there may be a blister on the bottom of the eye. Some of the systemic signs include fever and chills, headache, sweating, tachycardia, meaning an increased heart rate, nausea, and vomiting. If the disease progresses, there may be the central nervous system involvement, and a complication may occur, usually meningitis, irregular breathing, or a brain abscess. Now, there are some risk factors which increase the probability of an individual to be infected by cavernous sinus thrombosis. First of all, there are some infections like facial infections, acute sinusitis, or periorbital infections. In this, usually the causative bacteria is the Staphylococcus aureus. It leads to a formation of a septic thrombus. When a septic thrombus is formed, it is going to bring inflammation and pus along with it. The next group of risk factors is the hormonal. Pregnancy, postpartum, oral contraceptives, or hormonal replacement therapy. In pregnancy, there is a hypercoagulability state, and there is an increased chance of maternal infections, which increases the risk of an individual to be infected with cavernous sinus thrombosis. Usually, the third generation contraceptives increase the risk of developing cavernous sinus thrombosis. The next set is the immunosuppression, uncontrolled diabetes, steroids, cancer, or chemotherapy. In this, the immune system is not able to recognize and destroy any foreign body which invades the circulatory system. Others may include dehydration, thrombophilia, and obesity. In dehydration, there is an alteration of the systemic circulation which makes it more vulnerable for a person to be infected with cavernous sinus thrombosis. Also, in thrombophilia, there is an increased chance of an individual to develop thrombosis. So, a person is more likely to develop a thrombus who has a history of thrombophilia. Now, let's go through some of the investigations that are recommended in cavernous sinus thrombosis. The optimal diagnostic testing is through neuroimaging. Computed tomography, also known as CT scan, and magnetic resonance imaging, MRI. These are usually done, and some of the abnormalities which are seen are engorgement or dilation of the superior and inferior ophthalmic veins. There may be bulging of the lateral margin of the cavernous sinus, exophthalmos, meaning bulging of the eyeballs, and there may be the presence of sphenoid and ethmoid sinusitis. Another set of neuroimaging that can be done is known as CT venogram or MR venogram. So basically, a venogram is the type of an X-ray in which a contrast material is injected, and then we use the X-ray to see how the blood is flowing through the veins. So when we carry out CT venogram or MR venogram, some of the findings include dilation of the cavernous sinus. There may be asymmetric filling when the contrast material is injected. The orbital fat may be increased in density, or we may find a thrombus in the superior ophthalmic vein. We may also advise the patient to carry out some blood investigations. C-reactive protein, D-dimer, erythrocyte sedimentation rate, white blood cell count, all of these tests may be elevated in levels because of the simple fact that there is an inflammation in the body. So all of these values are going to be elevated. If it is suspected that the lesion has progressed and it has become more complicated, we are going to carry out lumbar puncture tests to exclude meningitis. Now, let's see how we're going to treat cavernous sinus thrombosis. First of all, we are going to give antimicrobial therapy. In this, third generation cephalosporins is used, which is combined with metronidazole for an anaerobic coverage, also antifungal therapy with amphotericin B. Parenteral therapy, meaning intravenous route, is used, and the antimicrobial therapy is continued for around 3 to 4 weeks. We also advise the patient some anticoagulants like low molecular weight heparin, and this is also again advised for several weeks to months. Now, the reason to advise the patient anticoagulant is that it stops the progression of thrombosis, it prevents clot formation and propagation, and it allows penetration of the antibiotics. But there are some risks involved as well when we prescribe anticoagulants. Risks like systemic or intracranial bleeding, or the septic emboli may dislodge and disseminate into the circulatory system. The patient is also advised some corticosteroids to decrease the inflammation and edema around the cranial nerves and the orbital structures. This will help to reduce some of the clinical features that we discussed earlier. And the offending tooth should be extracted and incision and drainage should be carried out. It is important to make sure that the origin of the infection is completely removed. So guys, this was everything about cavernous sinus thrombosis. I hope you enjoyed.